So I think for me, I've been with Roper St. Francis my whole RN career, basically in oncology way back from 2010. And we always had this like unwritten rule that you didn't take the chemo class or hang chemo until you had been off orientation for 4 to 6 months. Um, and I was from a inpatient medical oncology unit. So there was at that point, a lot of treatments outpatient, not a huge need for every nurse on the unit to be chemo certified to administer chemo at that time. So it worked out. And then fast forward 9, 10 years, our transplant unit and our medical oncology unit were on the same space for a couple years while we remodeled. And still, you still got away with, 3 of your best nurses being chemo certified. You could manage your assignment because not everybody was getting chemo inpatient. So once our remodel was done, we split into 2 separate populations. And so clearly when you have heme malignancies and transplant, everybody's getting chemo. So then it became, oh gosh, this is a part of a treatment for the care plan of all of your patients. You've got to bring that knowledge. So I think that's kind of where it started. In addition, COVID assisted us in weeding out some of our experienced nurses. So we had an influx of new grads. And then you had new grads, they come in eager, they want to learn. So even before I think we were really deep into this project, talking about like how to support our new grads, they started asking, all of my patients have gotten chemo or are getting chemo. Can you give me the class? They weren't necessarily asking, can I hang it or administer it? But it's a part of my patient's treatment plan. I need to understand more. So I think that's kind of where it started.
And our new graduates up here on BMT, they do participate in an inpatient nurse residency for the oncology track. So when Ashley and I were looking at them and planning for their education throughout their first summer here, we were looking at it saying they're coming in, they're doing cancer basics, then they're doing onc emergencies, and then they do a treatment modalities class. Where does this ONS course fit? Because they would get all that education in their first 3 months of hire. And then our current plan, they wouldn't get that ONS course until month 6, when really those nurses are probably pretty eager and prepared to take that course a little bit sooner. So as we started looking at that and discussing it amongst ourselves, saying, let's just throw it at them at the beginning and see how it goes. And that's how we ended up getting the results that we did. So we piloted having them take it early up here with 4 nurses. And then some nurses downstairs on our med onc unit took it a little bit later just to see if there was a change. And these nurses up here do, again, take care of patients on chemotherapy every single day. There was no way for us to avoid that. So that's where our results came from, that they did feel more comfortable taking care of these patients because they had that knowledge background. And again, this actually resulted in a lot of our nurses being ready to hang chemotherapy a lot sooner than what we originally would have even planned. So that was a benefit that we somewhat expected, but didn't expect.
And I think even too, before we got to putting it in place, the timing was really good that Kristi had just transitioned from another healthcare system that I think had about the same model as we did. And we went to conference and made sure, we identified it as, how do we support these new grads we're hiring? And so we kind of picked the brains of everybody and we kind of thought about like, well, why do we wait? Is there a good reason? Well, no, I mean, there's no evidence to say that you need to wait to provide education, right? So then it was kind of like this, I don't know if you call it a sacred cow or just this thing that we always did, but with really no reason behind it. So that's when we decided, yes, okay, let's spitball this. Let's, commit to the education hours from your budget, to their scheduling during orientation, pulling off the classes and the education, and then it worked out. I would say, I think it's kind of neat to, we had that first pilot group of nurses. We presented the data, it was accepted at conference, and then to bring that back to our team too, to say, hey, guys, this kind of started from y'all starting to ask us this is what we did, and look how recognized it is. So I think too, you're just increasing your buy-in. If you're a facility that has a professional nursing governance, then you're supported, you just keep fueling that, keep asking, and we'll keep improving type of thing. So we're just fostering that why and how can we change it and make it better.
Right. And supporting them through education is how they're going to want to stay and be around. And I think that it's easy to put this chemo course into a box and say, once you hang chemotherapy, that's when you're going to take the course. But this also empowered them to get a little bit more inquisitive on their patients and what was going on with them and kind of understand the full patient spectrum. So I think it's easier to say, like, this is going to give you upfront knowledge on how to protect yourself and what's going on with your patient. Don't worry about hanging it. But they really had it. brought more of a curiosity with these nurses that I hadn't seen before, and nurses that are fresh off of orientation. So I think it definitely increased their clinical confidence as well.
I will second that, because I think that one thing I tell people, if they don't ask me, but as a manager, when people interview, they always ask me, what do you look for in a good teammate? And I always joke and say, aside from coming to work and being on time, that continued drive to learn, because we know in oncology, research is ever changing, but there's so much information out there. You've got to have that. And so that's really us fostering what we want to see in our nurses to provide excellent oncology care.
I think we've had such positive results with this plan. We'll continue as is. And I think supporting nurses with that education up front is now our priority. So of course, we'll continue to evolve and add more things as we go along. But from here, I think we piloted this last summer, and every single nurse that started on our new unit will take that ONS course within the first 8 weeks here. So that's something we will continue to support that. But other than that, I think just supporting nurses right out of the gate, not really considering them as a new grad that they can't take in information, but recognizing that new grads are thirsty for that information and they do want it. So just supporting them in that way.
No, I think that's great. And I think that too, if we as nursing leadership know that right now new grads are our market. So they are coming in interviewing saying, how are you going to support me? So we really, you've got to up your game to support them, because you're not only are you hoping to engage a good, high performing nurse, but they're also interviewing you as a system and want the buy-in to know that you have good outcomes, you're supporting your teammates.
They are the future.
If you attend ONS Congress that's coming up, we'll be there too, because we did, again, 2023 was a big year for us to figure out how we were going to support our new grads, because that was our market and who we were onboarding. So I don't think I ever expected the positive feedback from all the education that we put in place. And I'm definitely an advocate of networking with other leaders in similar place to spitball ideas, even seeing how somebody does something now so that you can improve upon it and then go from there.